In summer seasons, because of the increased humidity, there is a chance of increased sweating. Now, what can this increased sweating cause? Denims are in trend, right? Summer season is the wrong time to go ahead with using denims. What happens? And lastly, it's the tan, which bothers all of us, right? So how do we manage the tan? First of all, summers is the best time for some because it has a lot of holidays, travel, unlimited fun and frolic, right? But along with summer comes some of the summer related problems, and they are all linked to sweating. So what are the summer problems and how to tackle them? Let's see in this video. Namaste, I am Dr. Urmila Nischal, consultant dermatologist at Nirmal Skin and Hair Clinic, Vijayanagar, Bengaluru. In summer seasons, because of the increased humidity, there is a chance of increased sweating. Now, what can this increased sweating cause? One is prickly heat. We all know that pricking sensation, especially on the face, the chest, upper back. So this happens because of the sweat being trapped inside the skin layers. Usually the sweat will be released on the surface, but during summers and people who are getting prickly heat, the sweat is trapped inside and you can actually see tiny water droplets, very tiny water droplets. Sometimes it can be on a red base. So it's the inflammatory miliaria or miliaria rubra, or if it is just crystal clear water filled bumps, then it is called as miliaria crystallina. What is the treatment? Cold showers. Trust me, cold showers help a lot to relieve this condition. Wear only loose fitting cotton clothes of lighter materials and lighter colors too. You can, if you are sweating too much, you can apply dusting powder on the affected areas. This will help to absorb the sweat and prevent it from getting trapped inside. So stay in well ventilated and well aerated places. Keep your fans continuously on, so you can have air coolers or the portable air coolers. That will be of great help. In children, sometimes the prickly heat gets aggravated and cause large bumps, especially on the scalp. They are called as periporitis. That is inflammation with secondary infection. They can be painful or cannot be, but usually they are seen on the scalp region or around the hairline. Huge bumps. You need to consult a skin doctor and maybe an antibiotic has to be given. Keep the hair short. Take head bath almost daily. If you're sweating too much, then you need to take showers twice a day. Denims are in trend, right? Summer season is the wrong time to go ahead with using denims. What happens with this is there is sweat entrapment. So usually in the body folds, when there is lot of sweat, there is moisture content, and this can be a breeding ground for the fungus. So usually during summer season we get itchy rashes, which is called as jock's itch or ringworm, in the thigh folds, underarms, under the breast, or any part of the body, but body folds are most commonly involved. So how you can manage this? So take showers twice a day, pat dry the body thoroughly before putting on your clothes, wear only loose fitting cotton clothes, reuse the clothes only after washing them and drying them in sunlight. While washing, you have to take care that you should reverse the clothes and wash them. If there is not adequate sunlight, then you can iron the clothes before using, and never share your clothes with others. You might need oral antifungals. Please do not self-medicate. Consult a dermatologist and take the oral antifungals. You can require it for 15 days, 20 days, depending upon the extent of the infection. Then you need to apply topical antifungal creams. Please do not apply creams which are available in the medical stores, which are in combination. So it will have antifungal, antibacterial and a steroid. Steroids will be the last thing required in fungal infections. They can cause more problem than any help. The steroids will reduce the itching and the inflammation, and you will feel that the infection is gone, but the fungus keeps on replicating and spreading. The moment you stop the steroid cream, the infection is only going to increase. So avoid using any kind of steroid creams. And how do you know that your cream has steroid? Check for names like beclomethasone, mometazone, halobitazole. So anything which comes with an added B or C or N, you should not use those creams. Use plain antifungal creams like laliconazole, ketoconazole, clotrimazole. That wouldn't be a problem. And lastly, it's the tan which bothers all of us, right? So how do we manage the tan? First of all, avoid unnecessary exposure to sun. Take protective measures. Wear a broad spectrum mineral-based sunscreen. Take physical protection like broad rim hats, goggles and scarves whenever you are outdoors. Wear full arms loose fitting clothing that will give you the best protection. In fact, these days clothes with ultraviolet protection factors or the UPF are available, so you can use them, or the sleeves when you are outdoors. And during the night routine, you can add a simple glycolic acid based cream, 6% for the face and 12% for the body parts. This is going to help you to prevent the tan and also get rid of the existing tan. Avoid scrubbing, rubbing and using home remedies, because if you are going to get exposed to sun again, this rubbing and scrubbing is only going to make the skin more sensitive and more prone to pigmentation. Though not so common, sunburns also happen. So these happen with prolonged exposure. So sunburn is not going to happen in each and every one. When you are exposed to high intensity ultraviolet rays, especially between 10 a.m. to 4 p.m. for a prolonged time, there is a chance of sunburn. What is the signs? You will have redness on the skin, you will have burning sensation, and after a couple of days when you touch, there will be pain in the skin becomes dark in color, dry and starts actually peeling in sheets. So first thing, if you are experiencing a sunburn, go do ice compresses. That helps. Apply soothing creams like those containing aloe vera gel or Scientiella asiatica. That helps to relieve the inflammation, the itching sensation. If the sunburn is severe, it can also cause blistering of the skin. Then this is the time that you have to visit a dermatologist, because you will need some anti-inflammatory oral medications which are only prescription based. I won't be able to tell the name right here. Along with this, vitamin C, the liposomal vitamin C will also help in repair the damaged skin. Avoid further exposure to sun. Let the skin soothe and repair itself for another 1 week or so. Complete photoprotection along with the measures discussed earlier are advisable.